Hello, everybody. We are going to get started. I first want to introduce myself. I'm Bia Carlini. I'm the Northwest ETTC webinar coordinator, among several other hats I wear here. As the slide says, questions will be taken at the end. That means please feel free to type it at any time in the box that you have in your slide. But we are going to just wait until the end. Many people ask to us, and we'll make a copy available of this presentation and the PowerPoint. It takes like 1 or 2 days to post in our website. The link is on the bottom of the slide here. We also, when we post it, we make it ADA compliant. So also having in mind people with different abilities. We realize that we have a diverse audience. We serve a diverse audience that also works with a diverse population. And we recognize words matter, and we try to respect diversity. So please, if you have any comments or suggestions about this webinar in this regard, or actually any other regard for this matter, please contact us on the email in this slide. We'll be very happy to hear and to learn from you. And without further ado, let's get started. So we are very lucky today to have a presentation on ACT, or Acceptance and Commitment Therapy, to the best possible person to present about this topic. So Jonathan Bricker is not only a colleague, but also a friend, and he is the founder and leader of the HABIT group. It stands for Health and Behavior Innovations in Technology. And he is a full member, equivalent of full professor at Fred Hutchinson Cancer Research Center, and also affiliate professor here at University of Washington. He has a long track of working with ACT in developing technological devices that in exploring technology to be able to apply the principles and the ACT offer in terms of dealing with addiction. He's also a licensed psychologist that also has a private practice. So without further ado, Jonathan, I'm passing to you, and as soon as you click the slide, you'll have control of the talk. Thanks so much for talking to us.
Thank you so much, Bia. I really appreciate it. Bia, are you able to hear me?
Yes.
Okay. So welcome, everybody, and thank you for joining. I want to just first show my disclosures, which are listed here. And this is our group. As Bia mentioned, we're the HABIT Lab. We're composed of mental health professionals and people who are conducting substance use intervention directly, as well as statisticians and managers, administrators in our lab. The focus of our lab is to develop and then test behavioral interventions to help people with addictions. And our main behavioral approach is ACT, Acceptance and Commitment Therapy. And the main addiction we focus on is tobacco use. And as you'll see, as I talk about ACT and its application to smoking, many of the concepts will apply to addictions of all types. Outside of my research, my private practice focuses on treating addiction using ACT. So what we do is to develop and test these technologies. Our goal is to help 1 million people to quit smoking. This is a list here of all the different interventions that we're conducting. We have a telephone delivered intervention that's delivered by master's level coaches for tobacco cessation. We have a web-based program called WebQuit. We have the I Can Quit app. We have the Quit to Heal app for cancer patients who smoke. And then we're also testing now a chatbot, which uses artificial intelligence and prevents a conversation with the user as if someone was an actual coach to help them quit. We are funded primarily by the federal government through funds from the National Cancer Institute and the National Institute on Drug Abuse. We're also funded by foundations and other sources, and our total funding we're grateful for is $15 million to date. So I mentioned my practice, so I will say more about that. It's ACT mainly for addictions. So what I want to talk about instead is where we're headed in this journey together. I'm going to briefly talk about why treating addiction is important, and then get into how to apply ACT for addiction in terms of what's the science saying. And I'll spend a lot of time on the practice, since I know a lot of people who are listening today practice ACT, or who administer or oversee the practice of ACT, they oversee addiction treatment, and are curious about how that works using the ACT model. So why is treating addiction important? As you imagine, you may already know, tobacco use in particular leads to 6 million deaths every single year. That's a third of all cancer deaths. So it's the most preventable cause of death worldwide. And the problem is, and this applies not just to smoking cessation, but to alcohol and drug addictions, is when you look at the different ways of treating interventions, and you start with individual, then you move to group, then there are some for delivering telephone interventions for people who live in remote areas or for whom access to face-to-face treatment is not practical for them, and then to web, you'll see that the reach is much greater, of course, with technologies. Websites can reach many, many more people, and so can telephone interventions. The problem is the efficacy of these interventions is much weaker. We use the example of smoking. The efficacy is much weaker when you go from an individual to a technology intervention. On the flip side, though, just before I move, the flip side, though, you can your population level impact can be much greater with a digital intervention, even though they don't work as effectively. So those are trade-offs that we have to make. If we're working with someone individually, we're more likely to help them, but we're not going to be able to help as many people because it's simply too expensive to do that. And there are many barriers to care: stigma, insurance, location, etc. And so we have to consider these trade-offs, and these are the kinds of things we grapple with as researchers, and that's why we actually do both. We do telephone intervention, and we also do technology. Okay, so here's the science, and this is what I want you to know about how well ACT is working right now. And before I get into, well, how does it work and what does it do? So we have a telephone intervention that was delivered by for smoking cessation, and what we found is that 6-month follow-up, 100% of the people were satisfied with the ACT intervention, and 31% were not smoking at the 6-month follow-up. That's in comparison to about 20% getting a standard cognitive behavioral intervention. So that was very promising. We are delivering this in the quitline context. These quitlines are available in all 50 states. They reach about 500,000 people, and they're modestly effective. And that's why quitlines, though, are available, is that they're available to so many people. Even though they don't have high quit rates, they reach a lot of people, and they can be delivered very cost effectively and very briefly. Every state has a quit line. So we are, I'll just quickly show you, this is how we set up our original study. Basically, we took 121 people and we randomized them to get 5 telephone calls, and we follow them at 3 and 6 months. That's what basically this chart is showing. You'll see that people were very engaged in the ACT program as compared to the CBT program. They completed an average of 3.25 calls versus 1.69 calls in the CBT treatment. And about half completed the whole program versus only 5% for the comparison group. They were very satisfied, as I mentioned before, in the ACT program, and more satisfied than in the standard program. And then this is the quit rate I showed you before, 31% versus 22% that I referred to before. These are some subgroups. So this is another way you can look at ACT, is that we're reaching people who are having challenges that are mental health challenges or challenges with how they're coping with cravings. So For example, people who are depressed, they do 3 times better in the ACT program, 33% success rate versus 13% success rate in the control group program. If they started out in the program being depressed, they actually benefited more from an ACT program for quitting smoking than for the standard program. So that is leading us to do a very large study right now. That I'll just say we were fortunate to get funding to do a 5-year study, and we are enrolling 1,200 adult smokers. We're following them for a year, and we'll know the results of that study in about 1 year. Okay, so the next thing I just want to briefly touch on to give you some context of the science is our web-based program, WebQuit.org. WebQuit.org is a program that is an ACT-based website, and here's the front page of the website where it shows you leaves on a stream. That's one of the exercises I'm going to be showing you in a little bit. Teaches you how to be with your cravings and let them pass on their own. Helps you track progress. WebQuit.org will be launched publicly for free to anyone in the world who would like to use it. The Fred Hutchinson Cancer Center will be is sponsoring a public launch that should happen in about a year. We're in the phases now of planning this public launch, but we conducted a very large study of 2,600 people, and we followed them for a year, and we found that 24% were not smoking at the 12-month follow-up. For a free website, that's excellent. A typical website only helps about 9% of people. And as you probably are aware from your own practice, it's very common that people who might be coming in to see you for example, for alcohol use or other drug use, it's very common that they'll also be using tobacco. This is a very simple way of being able to give them a resource for free that can go along with your treatment and help them be able to quit smoking. So like I say, webquit.org, we're looking to launch it in about a year. It will be free. I'll just quickly show you that people here from the website were satisfied with the program. They tended to be more satisfied than the comparison program, which was the US government's smokefree.gov. People like the program, the idea of letting your urges pass rather than trying to ignore them, and then some mindfulness exercises that I'm going to show you in a minute. I won't go into too detail about the quit rates, just that basically even people with bipolar disorder or who were depressed at baseline did almost as well as the people who were not depressed or bipolar, who were in just the general sample of the study, because this study was for anybody who was wanting to quit smoking. That was amazing. My colleagues, Noreen Watson and Jamie Hefner, are publishing papers on this very issue right now, but it was really astounding to us, because typically people with depression and bipolar disorder do worse. They don't do as well in treatment. And we're finding they did just as well from the website as compared to those who did not have these disorders. I won't go into too much on this, just that the ACT program is helping people cope with their urges. They're helping them let their urges pass. That's basically what this slide is saying. So the public health significance is that if you gave this program, the WebQuit program, out to 1 million people, you'd help 240,000 of them to quit smoking. That's astounding. And that's the kind of impact that we're excited we're able to make with programs like the WebQuit program. The last thing I just want to touch on is where we have some apps. And if you're interested in them, you can go to there's a company called Tomorrow. That's the number 2, Morrow, M-O-R-R-O-W, Tomorrow. And they have a program called Tomorrow Quit. It is based on our ACT program for smoking cessation. They licensed this app from the Fred Hutchinson Cancer Research Center. I have no affiliation with them. I don't receive any funds from them. Just do the research on it, and then that gets licensed from the Cancer Center. What I wanted to tell you, though, is that we have the I Can Quit program and the Quit to Heal programs that we're now testing. And this is some screenshots of what they look like. And so far, people have been very satisfied with it, and we're getting some very promising short-term success rates from that. But it's basically a leveled program. It's we call it a gamified program. Where you learn about your urges, you learn how to cope with them, let them pass, and then you focus on what's important to you that guides your quitting your values, which I'm going to show you. Okay, so now now you've gotten the background. You've seen there's a lot of scientific support here for an ACT for addiction, particularly for smoking cessation. Well, how does this work? What is this thing? Maybe you're curious about it, you've tried it, or you've heard about it, or you have a colleague who's tried it. So I'm going to just introduce first the concepts. So if you imagine that every day we live our lives, we have choices. And imagine you're at a restaurant or you're trying to decide what to eat. And we have a choice. For lunch, we could eat the fried chicken or we could have the salad. And those choices can be guided by what's going on in our heads, our thoughts. So you might decide, you might be thinking, I'm tired, or I'm stressed, or I have a craving, or hey, I'd like to have a drink right now. And so you can respond to those thoughts. You can also respond to how you're feeling. You may be feeling happy, you may be feeling excited or sad or angry. And those choices are also guided by our cravings in our body. So what I mean by that is you may be feeling hunger in your mouth or craving in your mouth, or you may feel something in your chest, or you may feel something in your stomach. And so those are factors inside us that can influence our choices about whether I'm going to have the chicken or I'm going to have the salad. And the problem, though, is that our thoughts and our feelings and our cravings, they can deceive us. They can tell us, I really need a donut right now, or I really need a drink right now, even though we may not really need a drink right now, or we may not need a donut right now. And so when we focus just on what our thoughts and feelings and cravings are, and we take them literally, we take them for what they say, we can make choices that are not helpful to us, or not effective choices, or choices that are harmful to us. And so there's two answers to how to deal with this problem of the deception of our thoughts, emotions, and our sensations. And the two answers first come from how to be willing to have thoughts, feelings, and cravings come and go without acting on them. And I call that willingness. That's also referred to as acceptance. And the other way to talk about it is to just let thoughts, feelings, and cravings come and go, to let them be there, to open up to them, to just let them pass on their own and come and go without trying to push them away, control them. Now, I'm not talking about willpower. So I do use the word willingness. A lot of people say, oh, you're talking about willpower. It's not about willpower. It's about the will to make a choice about what to do with these internal experiences, our thoughts, feelings, and cravings. And some of you may connect this to mindfulness. They say, oh, this is mindfulness. Well, it is and it isn't. Mindfulness is one way that a person can be willing. So you can practice formal mindfulness. You can do seated meditation. But you don't have to do those things to be willing. You can allow a thought to come and go without practicing any kind of formal mindfulness. So for some people, this is a relief because mindfulness can seem intimidating or spiritual, or it's just plain weird. And for other people, this is actually very encouraging because they may already be doing mindfulness and they'd say, oh, I can plug ACT into my mindfulness practice and it makes sense to me. So either way, you can go either way. So you don't have to be mindful in order to do ACT, but certainly mindfulness is a tool that's part of the pathway to be willing. And why is willingness so important? Now, I talk about this in my TED Talk. I've given a TED Talk you can look up. It's called The Secret to Self-Control. You can find it on YouTube. Really easy. Just enter The Secret to Self-Control, or you enter my name and you'll find it. And willingness is so important because it helps us see choices really clearly. And so if you're really focused on the thoughts in your head, and you're thinking, oh, I'm tired, I'm stressed, I'm craving a drink, sounds really good, and that's all you're looking at. So we would say you're looking at the world very literally. You're paying attention to these words as if they are truth. It's really the world in front of you gets blurry. The things that matter to you get blurry. You don't see them as clearly because you're in your head. On the other hand, if you look on the right-hand side, if you just let these thoughts go to the background and just kind of let them be there, they become kind of blurry. And the things in front of you become very clear. The things that really matter to you become very clear. And so it helps you see the things that matter to you really clearly. That's why willingness is so critically important. It helps you live a life of meaning and purpose. Now, the second reason why the choices matter, and that there are two ways to really deal with these internal experiences we all have, thoughts, emotions, and sensations, is that we can focus on our values. And as I just referred to, you have things in front of you that really matter to you, and they are our personal mission statement. They are the things that guide us. They are the things that lead us to make really important life choices, like the choice to become a chemical dependency counselor, or the choice to be helping others, or to be in a service profession. That comes from a place of deep values that is inside us. And so some common values that people will often say are to take care of their body, or to love their family, or to help out the next generation, like grandchildren, or to do some kind of meaningful work. And so over time, you can begin to help a person put to words, or even a picture, what they really care about, because that guides the choices that we can make in everyday life. We all have values. It's just about being able to articulate them, see them clearly, so that then our actions align with our values. So the simple equation I put together is being willing plus acting on your values leads to life-affirming choices. It leads to life-affirming choices. That's a really important equation because it just puts it all together. And those life-affirming choices, they can be focused on what you eat, whether or not you decide to use, whether or not you decide to affiliate and spend time with people who are using. Those are choices that you can make every day. And those choices are either moving you toward what's important to you or moving you away from what's important to you. And in ACT, we're really trying to help people move toward what's important to you and really make what we would call a life-affirming choice. Now, ACT often uses visuals to communicate, and this is a visual I love to use to quickly communicate what ACT is about. So we see this gentleman moving in a valued direction. He's steering his motorcycle in a direction. So it's his compass heading. It's the direction he is heading in his life. And like all of us, he's got baggage. He's got stuff in his sidecar that he's got to make room for. And so he's found a creative way to make room for his baggage. Now, you might be wondering to yourself, well, why doesn't he just cut off that sidecar so he can go faster, so he doesn't have to have a load to carry? And well, in the physical world, you can do that. You can choose to unhook the sidecar and drive the motorcycle around and lighten your load. In the world inside our bodies, the world of thoughts, emotions, and sensations, that doesn't work. So trying to suppress our thoughts, trying to think of something else, trying to not notice pain that we're feeling in our bodies, trying to ignore a craving, what that will do is create a paradox or an ironic process or a backfiring kind of like the more you don't want it, the more you get it. So if we try not to think of cravings, if we try not to think about how much we want to use, we can actually get more thoughts like that coming back. And a simple way to illustrate this that we can do during the Q&A, if you like, as together an experiential way, is trying not to think of a white bear. If you spend 30 seconds trying not to think of a white bear, find out what happens. I won't give you the answer, but just experience that. And that's a very common way to try to illustrate ACT ideas, is not just words coming out of my mouth as a presenter or your mouth as a counselor or facilitator. It's more about letting the participant, letting the client or the patient experience that on their own. And so having them do an experiential exercise like the white bear exercise is a great way to be able to illustrate the idea that what works outside in the physical world doesn't work inside our bodies, and that the more we try to push it away, if we try to metaphorically cut off that sidecar, we actually don't make the progress we're hoping to make. We actually end up getting it backfiring and often getting more of it. Okay, so getting into the practice, there's a really important theory that guides ACT. Now, I know some of you wondering, you see the word theory and you say, oh, gee, theory. Boy, that seems really heavy. And what's this thing called relational frame theory? Now, to learn ACT, you do not need to learn relational frame theory. I will say that. However, to learn ACT in a more deep way and to really make it a part of how you see yourself as a therapist and how you work as a therapist, it is important to learn about it. So I do want to just give you a really brief take on what is relational frame theory and how it relates to ACT, because even if you're learning ACT in a more casual way, you'll hear people who talk about ACT throw around RFT, or relational frame theory, and you might say to yourself, well, what's that? I don't know what you're talking about. That's a lot of gobbledygook. And I want you to be able to understand a little bit of the gobbledygook so that you're in on it and that you're able to understand what's going on. So I'll just briefly explain this. Imagine that someone is having a physical urge. Now that urge gets connected with things we do and the things we feel inside. So we might take a break and we have an urge. We might go have a drink and we have an urge. Those are things you can see people doing. So those are things we do with our hands and our feet. We go take a break and we're drinking. But we also have a thought in our head, urge, and we might think, oh, I must be stressed right now. So urges, physical urges, can trigger thoughts in our heads like stress or urge. It can trigger other words too. These are just examples. Now, in the case of someone who, let's say, is smoking, they could be smoking marijuana, they could be smoking cigarettes. That thought, I have an urge, or the thought, I'm under stress, can get connected to a whole set of behaviors like tasting, holding, inhaling, and smelling, and reaching, and lighting, and exhaling, and ending. All the sequence of things we do when we're smoking. We're smoking a cigarette, or smoking marijuana, or smoking something else. So there's a whole set of behaviors that then gets connected to a thought like, oh, I'm going to go and start lighting up right now because I have a thought that I have an urge. The problem is when that's all we're doing, we're really caught up in our addiction, it pushes us away. So you see those dotted lines from living the life that we value. So living, say if your value is living a healthy and loving life, which may get connected to doing things like exercising or taking time with your family, since our values lead to certain activities that are consistent with our values, we get a little disconnected from them. So I say this web of addiction occludes, or it gets in the way of living a valued life. And so that's the consequence of how we get caught up in this web. So the answer that ACT has to this phenomenon, to this problem, is to help break free from the web. So to turn a dotted line to a solid line, meaning to get connected to your values. You get connected to living a healthy life, to exercise, to time with your family, to really doing values consistent activities, so that you're not connected to this web. Now, what I'm also saying is that these web of connections are always there. They're always going to be connected. So an urge may they be in your life become connected to taking a break or feeling stressed or drinking, and that may get connected to reaching for a cigarette and lighting up. That history is always there. So we say that behavior is historical. So you can't erase history. Instead, what it does, what you're doing when you're doing ACT is you're building a new history. You're building a history of doing the things that that really matter to you, that don't involve using your drug of choice. Okay, so as I was saying, that life gets really, if you're caught up in the addiction, the web takes over your life. All right, so that's just a really brief overview of relational frame theory. No more theory talk. Let's get into the skills. Okay, so in our group, when we do ACT, we follow 5 steps. And so it's helping a person make a plan. It's helping them be aware of triggers. It's helping them be willing. It's helping them be kind to themselves. And it's helping them stay inspired to really live their values. So I'm going to walk through each of these steps. Okay, step 1, in making a plan. So what you would see here is, what is it that's really, really important to you as a person? So you would ask your client this, what really matters to you? How do you want people to remember you when you turn 80? What would you like written on your tombstone? What would you like people to say about you when you retire or you stop working? And so those are just some practical ways to start to get at, what matters to you? What matters to you? What kind of family do you want to have? What kind of relationships do you want to have? How do you want to spend your money? If you had more money, how would you spend it? Those kinds of questions really quickly get at what matters to a person. You use values then to set a goal. And for addiction, that might be harm reduction or it might be abstinence. And then set a target date. When do you want to reach that endpoint? Now, if depending on what setting you're in, you may use medications, you may not, and it just depends philosophically where you are and where the client is, but it's an option. And so if that's a conversation, you can talk about how it can help with cravings and withdrawal. We also emphasize, as many therapies do, about talking to your inner circle. Who's in your inner circle? What do you want them to say? What do you want them not to say? Do you want them to come to sessions with you? How do you want them to support you so that they're actually not derailing you from your treatment goals? And so what you then do is you start this plan in session, and for homework, you'll have the clients complete something for the next session. So this looks a lot like a standard cognitive behavioral treatment for addiction, with the key difference being we front load it with values. So you might say, oh, this looks really similar. It is. The difference is we're talking about values first to guide those goals. Then things start to move a little bit more away from the standard program. We call trigger tracking. We start with the outside stuff. Everybody can talk about what's going on around them. Oh, I drink when I have an argument. I drink when I'm driving. I drink when I'm eating. I drink when I'm at a bar. Anything you're doing that's outside, those are usually easier things to notice. And then you start to move inside. That's a little harder for someone. Maybe when you're stressed, or you're bored, or you're guilty, or you're ashamed, or when you're happy or excited. You can begin to feel and differentiate these different types of emotions that we feel. And if they need it, helping them understand what these different emotions are. Since some people may use these words, but they don't really know what they mean or know what those things feel like. And then the physical sensations. Where in your body do you feel a craving before you're about to drink or use your drug of choice? Maybe it's your chest, your stomach, your mouth, your throat. Those are common. Then it gets a little bit harder, and that's why we build up to it, is we begin to ask them what's going through your mind. And sometimes people say, I don't know, I just use, I just get together with my friends and use, I'm not really thinking. And so really want to slow that down and look at, well, what's going through your mind? Like maybe you like just before you're trying it, what might have been going through your mind? And usually as people start tracking situations, feelings, and sensations, they naturally get to the place where they say, yeah, I guess I was thinking something. So they might think, oh, I'm just going to have one. Or they may be very self-judging. They say, well, I'll never change, so I can't do this. So this is a really important part of the treatment, because you can't be willing without being aware. You have to be aware of these internal experiences of feelings, sensations, and thoughts before you know what to do with them. And so it's important in your sessions and for the homework, you try to help them notice what, just before they had that urge, or just before they used, what were they doing? And we use a triggers checklist to help them with that. And we ask them to track at least daily, at least 3 times a day if they can, for a week. Now, of course, it just depends on your client, your setting, but this self-monitoring or trigger tracking, super, super important. We always get people saying after a week, saying, you know what? There were things I noticed I didn't realize I had. I didn't realize I had thoughts before I used. I didn't realize I had feelings before I used. I thought I just used. And so they discover really important things by doing it. Now we're getting even deeper into the ACT part. That's really different from all our therapies, is the willingness part. And there are lots of stories and metaphors to illustrate it. There's a book I would recommend if you're curious about ACT for addictions. It's called The Wisdom to Know the Difference by Kelly Wilson, W-I-L-S-O-N, The Wisdom to Know the Difference. So here's an example of a very common ACT exercise, and it's called the urge monster. And you imagine that you're in a tug of war with this monster. It's the urge monster. And the more you pull, the harder the monster pulls back. And if you're trying to push away a craving, the monster just comes back with a bigger craving. And so that's an important reaction for people to see. It's like you're pulling, you're trying to get rid of it, and it comes back. I illustrate this in the TED Talk on stage, and it's just to help illustrate what's going on when you try to push your urges away. Now, the flip side of that is to drop the rope. You don't get in this tug of war anymore. And what drop the rope means is that you're not giving into your urges. You're giving up the struggle with them and just letting them go on their own without trying to push them away or do anything with it. Now, I know that's easier said than done, but it's a really important skill. It's the crux of the therapy, is learning how to let urges pass. We have learned in our research that people who let urges pass are 11 times more likely to quit tobacco use. This applies to other substances as well. So this is the meat of it. It's the heart of it. It's all happens right here. It's letting your urges pass. Urge monster is a nice example. There are lots of ways to illustrate the idea of letting yourself just drop the rope, but it's absolutely critical. It's really what defines ACT, unlike other therapies. There's another example of trying to be willing. It's a really straightforward question. Is 0 to 10, how willing are you to have a craving? Or how willing are you to have your craving and let it pass? Yeah, I'm not willing is 0, 10, I'm completely willing. It's a really important way to monitor how you're doing as a client in terms of letting these cravings come and go. Can you make room for them? If willingness is low, the question I love to ask people is, have you ever done something important that was really hard to do? And people might talk about maybe raising a child or finishing a program or school or something like that. Willingness is like that. It's being willing to do something really, really hard, but it was important. So for homework, I'll often ask clients to rate their willingness to have an urge and then rate it again, so that it becomes a way of living, really. Living and breathing willingness is the heart of ACT. Another nice example is the 5 senses. It's a really simple exercise. For 60 seconds, you notice 5 senses. So notice one thing you see. You spend about 10 seconds on that. Notice one thing you can touch. Notice one thing you can taste. Notice one thing you can smell. You wait about 5 to 10 seconds. Notice one thing you can hear. Now, what that helps people do is to get out of their heads and get out of whatever craving they're feeling and to see the larger picture, to see that our sensory experience, our everyday life is much, much greater than simply the craving or simply the thought or simply the anger we're feeling towards someone. There's a much larger experience going on. There's almost a rainbow of experiences going on. And this simple exercises helps you see all the colors of that rainbow, the sight, the touch, the taste, the smell, and the hearing. That's why we would do such a simple exercise and yet so powerful. Okay, another example of being willing is leaves on a stream. This is a classic exercise from ACT. You can see it in almost every ACT book, and by now there are about 75 different ACT self-help books that are on the market. Leaves on a stream. So in this exercise, you close your eyes and you imagine. Imagine that you are seated beside a gently flowing stream. And on that stream are leaves. And on each of those leaves are your thoughts. Let those leaves gently float down the stream. As you sit on the side of the stream, just looking out and just watching those leaves with your thoughts on it, gently pass by and drift off. And if thoughts keep coming back, put those on a leaf and let each leaf gently float down the stream and go off into the distance. And so you do this and then you go silent. And if we were working together in a therapy session, we would go silent for about 1 to 2 minutes. Just as the client with their eyes closed or looking at a spot just lets these thoughts come and go on their own. So I've given you a snapshot of some common willingness exercises. I want to just briefly talk about kindness. Kindness and self-compassion is a piece of ACT that has come more recently, and it's actually taking from another therapy called compassion-focused therapy, and there's related therapies and self-compassion therapies. And it's I call it a close cousin of ACT. It fits the ACT model really nicely. So we have integrated it into our programs for smoking cessation because when people are trying to get over an addiction, there's an incredible amount of shame and self-loathing that comes with it. They feel very judged by family, by society, by the laws that are placed, that are designed to protect the public, but have a flip side of alienating and shaming people with an addiction. And so there's the shame you bring on yourself, self-criticism, and then there's the really what I'm referring to as stigma, the outside, the societal judgment of your behaviors. So that's why we brought this in and why it's so important. So here's an example. It's called "You Deserve Kindness." It says, and I say, we attack ourselves all the time. And just give some examples. You know, I'm not able to stop drinking. What's the matter with me? I'll never be able to do this. And so you ask yourself, is this really helpful? Is this kind of attacking helpful? Honestly, to say this to yourself, is it really, really useful? Is it really, really getting you to change your behavior? Or is it actually getting in the way of changing your behavior? And so really take a moment to kind of reflect on that question. And then I would ask, well, how would you like to spend your time? Would you like to spend your time attacking yourself or doing things that matter? And most people say doing things that matter. And so it's just helping you break loose of the cycle of attacking yourself and seeing that this is actually not helping the problem of your addiction and helping you live the life that matters. So instead, how can you be kind to yourself? What could you be doing to be kind to yourself? And it doesn't have to be something complicated. It could be taking a walk. It could be taking a break. It could be closing your eyes and noticing your breath for 1 minute. These are really simple things that anyone can do at any time of the day that are really short, that are little small, little micro acts of kindness. And the reason why is because you matter. You are worth it. And so that's an example. We have lots of examples, but this is one that is a popular one. Here's another one called Time to Forgive. We are always attacking ourselves for things we've done. We attack ourselves for the choices we're making, for relapsing. And we can forgive. So imagine you're at your wisest and kindest self. Can you look at what triggered your choices? Can you see the context? Can you see that maybe your friend came over and brought alcohol or brought drugs over? Can you see that maybe you were having a really difficult day, that someone left you, that you had a serious argument with someone? And can you understand that in the context of that made sense, that you might have slipped and relapsed in this situation? And once you see your context and you can see that other point of view, you say to yourself, I forgive you. You put your hands in your chest, and you say, I forgive you. You repeat it 3 times. I forgive you, I forgive you, I forgive you. It's really, really powerful. And you can see people feel emotional when they say this to themselves, especially you're guiding them, you're saying it with them. It's a very powerful moment clinically. And it is a way to lift the burden of this incredible judgment that people feel for their choices about their drug use. Okay, just in the interest of time, I'll just briefly say this is another self-compassion exercise for slipping. Imagine you have a cute puppy. It's scared, it's stressed out, maybe it almost got hurt. How would you deal with this puppy? You'd be reassuring, of course, you'd be comforting. And maybe you like cats, so you could do it with cats. Would you give this puppy a beer? No, of course not. You wouldn't give your puppy a beer. So, but would you do that to yourself when you're stressed? Notice how you treat yourself when you're stressed. So you flip perspective. You wouldn't give a puppy a beer, so why would we do that to ourselves when we're stressed? And that really is thought-provoking. It gets people seeing like, oh, can we treat ourselves as well as we treat the puppy? And that's all I'm going to say about that exercise. It's very provocative and gets people really thinking about perspective taking and self-compassion. Okay, finally, throughout our program, and I would encourage you, if you're learning about ACT and practicing ACT, that you pepper your sessions, if you will, with values. So you bring values in as much as you can. And there are a couple ways to do that. In addition to the ones I've illustrated, you may ask someone what really matters to you, what you stand for, what kind of photos do you have for inspiration. Often people will have photos of their partners or of their children, or some kind of symbol that represents the life that they idealize and the life they want to live. And what would that life then look like? What would you be doing every day? What kind of actions would you be taking every day? Because values are abstract, and sometimes people have trouble seeing them, or they're just not comfortable thinking about their life in this abstract way. So you can say, well, what would you do that would be living in the way you want to live? And then you can go back to like, oh, that must show to me that you value caring for others or giving to others, or connecting with other people because you want to spend time with your friends, or things like that. So to kind of move back and forth between these really concrete actions to more abstract ideas about values, and then back to the concrete and back to the abstract. It's an important thing, because I won't get into the relational frame theory, but there's something really powerful going on in there in the background that you don't even have to name. But if you can go back and forth between these kind of high level things of what I care about, how do I really want to connect with people, to actions like I want to spend time with my friends, it does something really powerful for the mind. Okay, The last thing I'm just going to cover is about the letter from the future. And this is a relapse prevention exercise. Imagine it's 10 years from now, you're sober. What wisdom would you like to share with you, the current you? So what would your letter from your wiser self look like to your current self? And so some ways to help you get thinking about that. And I would encourage that you do this first as a talking exercise. You talk it through, and then you work on writing it down. That's often much easier for people to do. What tools from therapy would you suggest to your younger self? What would your wiser self give as encouragement? What kind of kind words would your wiser self give? What does your wiser self learn 10 years from now that your younger self could listen to and hear? And so you can write that together or think that through together. It is important in the end that it be in writing. It doesn't have to be fancy writing or long paragraphs. It can be telegraphic. Is that it's in writing. And there's something permanent about writing that really makes an exercise powerful, that someone can come back to it and look at it and say, wow, those are my words. These are the words I am speaking to myself as I'm now in the midst of feeling like slipping or trying to recover from a slip. And so that's the letter from the future. And I'll just briefly say, from an ACT perspective, motivation is purely optional. You don't need motivation to change. It's a really provocative idea, but it's really about what actions. That's what matters. Knowing your values is what matters, and taking action is what matters. And of course, in the 80s, maybe without realizing it, but Nike gave the slogan for this, which is just do it. Okay, so in summary, the five steps can be summarized with this brakes metaphor. Put on the brakes, read what's there, notice your triggers, expand and exhale, allow everything to be as it is and be kind, to know what matters to you, and S, to step it in that direction. Just do it now. Okay, so that is the end of the presentation, and at this point, I would be delighted to take your questions.
Okay, thank you so much. This has been really, really good. Before we take the questions, and thanks so much, we want to remind you that you're going to get a survey in your inbox. We're going to send it now, just after this, and then we're going to send it again in a month. We need that. This is what keeps our program running, and we need to collect your take on it. Appreciate so much. It's quick. And we are gonna now go for, let me just see. Okay, so now we are gonna take the questions and go to see what people think. I see one question about the PowerPoint, and yes, we are gonna get the PowerPoint to you, as we said in the first slide. I'm trying to understand some of the questions here. There is one question about what gobbledygook. What is gobbledygook?
I think it's just a word that Dr. Bricker used. What does gobbledygook mean? And someone later said, I think it just means jargon.
It just means jargon. So one of the challenges of trying to explain something to someone is say, oh, it sounds like you're using lots of big words. I highly encourage you to try not to use a big word. Try to use a $1 word instead of a $5 word, because you don't need to use big words to get an idea across. And so jargon, gobbledygook, psychobabble, these are just ways of saying we don't need to use fancy language to get across these ideas. These ideas are powerful, and actually the best way to learn ACT is by having people just experience what you're talking about. So having them do Leaves on a Stream, for example, or the 5 senses. That is a much more powerful way than you explaining it. And so that's what I'm getting at, is to really take that framework. And in the TED Talk, I kind of jokingly refer to that as well, because I think it's a really important thing, so that it's not alienating, and it creates more inclusivity, so people really feel like you're talking with them and you're really connecting with them when you explain these ideas, because they're big ideas, but they don't need big words.
Thank you. That's very good. And there is one question here about how somebody can obtain a more formalized training in ACT. I don't know if you're aware of places and you got this, or
absolutely. Yeah. So the first place I would go is the main website for the group that supports ACT, and it's contextualpsych.org. Not clearly named, I'm afraid, but if you look up contextualpsych.org, you will find contextualscience.org, and I know it's a mouthful, unfortunately, and I can send the link also to Bia. In there are a wealth of resources about handouts for ACT, slide presentations for ACT, video presentations for ACT, that are focused on ACT in general, ACT for addictions, ACT for mental health problems. And so there are so many resources that you can learn just from there through that website. The other way is on that website is a list of all the trainings, and the trainings are delivered by people all over the world. They are delivered at different times, just depending on those people's schedules. We have, in addition, an annual conference. It's the main conference. The next one is coming up in Dublin. It's because it's international. I mean, the ACT community is 8,000 people, professionals who are part of this professional society. They're all over the world. So usually we meet in different countries depending on the year. And then that's in the end of June. There'll be workshops, many workshops for training in ACT. In addition, the year after, it'll be in New Orleans. And that will be, I believe, also the end of June. So I would go up to that website. You can see local trainings, and then the big conference trainings for if you want to learn more about ACT, formalized. And then, as I mentioned, the book, The Wisdom to Know the Difference. I think that's the best book that practitioners and clients can use for doing ACT for addictions, the Kelly Wilson book. There's tons of resources, but I start with the website. That's the best place to start.
Thank you. So we have about 3 minutes. So there was one question that I think is pretty much a yes or no, but maybe a little more than that. And then I'm going to try to get to the last question that I think it needs more, more, elaborate a little more. So the question that I think is short is, until the more focused apps are available, would you recommend or not the ACT Coach app available free from the VA?
Yes, I think that's a good app. I think the broader answer to your question is I would try it out and have your clients try it out. And if you have a client who's using it, I would sit with them, show them how to download it and how to get in it and how to walk through it, because usability is a big challenge, depending on people's comfort with technology and skill set. But that's a broader answer to your question. But that app is fine, but it really depends on the user. And so I think it really comes down to your comfort and the client's comfort in using that particular app.
Perfect. So then the last questions, because we are wrapping up here. We have like 1 minute, but feel free to take 2 or 3. Will you please Will you please explain again how willingness helps you see choices more clearly? Is willingness the same as motivation? Please say that website again. We won't say it. We're going to send it to you guys later, okay? So that'll be the last question before we wrap up.
Yeah, so willingness is not the same as motivation. Willingness is about being open to your cravings, to your thoughts, and to the feelings that you feel. That is willingness, and the goal is that if you can be open to your thoughts, feelings, and cravings, then you can focus. You're freed up to focus on doing the things that matter to you. So a metaphor, another way to often act is explained through metaphors. So a metaphor might be, imagine the sky is cloudy and you look up in the sky and you really want to see the sky and all the expanse of the sky. The clouds are in the way. Well, your thoughts, feelings, and cravings are like the clouds. And so when you're willing, you're opening the clouds. The clouds are opening up so that you can see beyond the clouds and see, like, way out there is the sky, the whole expanse of life, the whole possibilities in front of you. And so it clears things up for you so that you can do the things that matter in your life.
That's great. Perfect. Well, thank you so much again for your participation and your contributions today. And good to always learn from you, Dr. Bricker. And we'll finish up now. This is our next webinar a month from today. Take or give, so it'll be our June webinar. It's going to have CME credit available, so it's a different thing. We usually don't do that. I encourage you guys to attend. And yeah, thank you.
You're so welcome, Bea, and thank you everyone for tuning in. I appreciate the opportunity.
Okay, bye now, everybody.